Okay, so we want to look at the step-by-step approach to trying to access the joint. That's in an orthopedic patient. So a patient comes around and he has issues with his joints. So I'm trying to step-by-step approach this, trying to access the joint so that I can pinpoint if there's indeed an issue in the joint, and if there's an issue, which type of issue. So for assessment of joint, of course, this one is just you are trying to do all those active range. So you're asking the patient to actually do some 1 or 2 movements and all of that, so they can see where they are deficient in. So you're accessing here, it combines clinical examination with imaging. So what you see on physical examination, right? You also tell the patient to go and do all those X-rays, CT scans, or MRI, to now back up your points. But it's what you see on physical examination that will now make you know the specific type of imaging you need. So first of all, inspection. So you have to do symmetry. So if the structure you are trying to examine is on 2 parts of the body, look at how it is on the left and compare with the one on the right. That one will help you dictate if there's a muscle wasting, if there's a swelling or deformity. Look at skin changes. Look at alignment. How are the bones alignments? How are they aligned? Is it in a proper alignment or is it distorted? Look at the nails and the fingertips. Palpate. We are trying to feel up for the temperature, for the tenderness, for the swelling, or you move it a little bit to see if there's any crackling sound. That's what Crepitus. Can you see how you are doing this? So she's taking it up, she's taking it down, she's taking it up, she's taking it down. Right? So range of motion, this is when you have the active range of motion where the patient is actually doing the activities. This one is passive, she's actually doing it for the patient. Stability test, you're trying to look at all those ligament integrity and joint laxity. So functional assessment, you look at all those gait analysis, strength testings, special maneuvers. So radiographic imaging assessment, this is when you now go for X-rays, MRI, CT scans, ultrasound, DEXA. So for each one of them, I listed the possible pathology that will actually make you request them. So you can actually pause to have a detailed view into this page here.